Covid-19 is an infectious disease caused by a virus called Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2 for short. The virus targets the respiratory system and spreads primarily through the droplets of saliva or discharge from the nose when an infected person coughs or sneezes. All age groups can catch COVID-19. While we are still learning about how COVID-19 affects people, older persons and persons with pre-existing medical conditions like high blood pressure, heart disease, lung disease, cancer, or diabetes appear to develop serious illness more often than others.
COVID-19 case jumps to 6,075 on 19th May 2021, breaking the nationwide record with the total number of deaths reaching 2,040. Do you know the situation faced by the frontliners handling and controlling the COVID-19 patients each and every day?
COVID-19 has turned into a pandemic that affects the whole world. For all these changes that affect all of us, we don't need to look far and wide. Take our own country, Malaysia. The number of cases are increasing every day. Therefore, we need to follow the SOP, such as washing your hands regularly, wearing a mask, and keep your social distancing.
Do you want to hear the stories of frontliners and more information on COVID-19?
Join our COVID-19 awareness forum as we talk about experience sharings from frontliners, facts about COVID-19 vaccine, public health awareness, and protection tips. On that day, 4 special speakers will be joining us with exciting topics to talk about. The date will be on 29th of May 2021, Saturday, from 8 p.m. to 9 p.m. We will conduct the forum through YouTube Live, so don't forget to subscribe to our channel and ring the bell to be the first one to know when we go live.
Don't forget, coming Saturday, 29th May at 8 p.m. Greetings everyone, welcome to Zenitiq Talk Forum on COVID-19 Awareness organized by Zenitiq Solutions. Thank you so much everyone for joining us tonight at 8 p.m. I believe your time will be interesting for this upcoming 1 hour, and we have 4 special speakers with us today to share their experience as clinicians and experts. So it's my pleasure to introduce the speakers for tonight. First of all, let's welcome Dr. Sazali bin Basri, clinical specialist from Infectious Disease Unit, Department of Medicine from University Malaya Medical Center. Hello, Dr. Sazali.
Hello, hi.
Yeah, thank you so much for joining us.
Thank you for inviting me.
All right. So next, let's welcome Dr. Kanageswary Ganggayah, House Officer at Hospital University Kebangsaan Malaysia. Hello, Dr.
Hi,
Kana.
hello. Hello.
Thank you for joining us.
Thank you for inviting as well.
All right. So next, let's move on to Dr. Mohamad Helmi bin Mohamad Yasim, Medical Officer at University of Malaya Medical Center as well. Hi, Dr. Helmi.
Hello, everyone. Good evening.
Yeah, thank you for joining us. All right. So next, we have Dr. Sivanantini Subramaniam, another house officer from Hospital University Kebangsaan Malaysia. Hi, Dr. Nandini.
Hi, hello everyone. Thank you for inviting me for today's talk.
Yeah, it's our pleasure to have you in our forum on COVID-19 awareness today. All right, without further ado, let's start with the experience sharing from frontliners and the very new house officers from HUKM. So kindly please, all the other speakers and tech admins, please mute yourself for a while the other speakers are presenting. Yep. Thank you. All right. First of all, we have Dr. Kana with us to share her experience as frontliner during this COVID-19 pandemic. So the room is yours, Dr. Kana.
Okay, hello everyone. First of all, thank you for inviting me, Zenitiq. So my name is Kanageswary, Ganggayah, and I'm working as a house officer at Hospital University Kebangsaan Malaysia. So currently I'm in my 5th posting actually in Pediatric. So I was given a topic to speak as a frontliners experience. Okay, actually, frankly speaking, house officers are actually not allowed to handle COVID-19 positive patients. We just help our medical officers to when they are doing procedures or for the COVID-19 patients, when they are taking swabs, we do help them. But at some points, there are situations where the patients that we think that normal patients, that we handle them, when we swab them, they turn out to be positive. Yes, we do have many patients like that. So what am I going to talk today is I'm just going to share my experience, because when COVID hit our country last year March, so I was in a medical posting. So that was the first time when we facing COVID patients in our hospital. So that time I was in medical department, and that was the first ward which turned to be a COVID ward. So, and yeah, Nantini was with me as well. So because I worked AM shift and Nantini worked night shift on that day. So what happened was, so these patients came in, and initially we thought that patients were SARI patients. SARI patients meaning that we suspect that the patients might have any respiratory distress. So, but then at one point we thought that, okay, based on the history, we thought that, okay, these patients won't have COVID-19. So we, initially the patient was isolated, and then that patient, when we thought that he won't be a positive patient, so we shift him from the isolation ward, then we put him into the normal cubicle. So what happened was, the next day when the result came out, he was a positive patient. So we never thought that he would turn a positive patient. So because we handle the patients like house officers, we took blood for him, we helped our MOs, so we did everything. So everyone panicked. That was the first ever time. That was our first positive patient in our hospital actually. So, okay, I don't want to mention his name. We will just talk as Mr. A. So what happened was, why we didn't think that the patient would turn to be a positive patient? Because of the history that he gave us. He told us that he has no history of traveling. He has no history of attending mass gathering. But then the next day when he turned out to be a positive patient, and then he told us the truth that he had traveling and he attended a mass gathering. So these kind of things are actually everywhere. All the hospitals, all the clinic kesehatans, everywhere when patient goes, maybe they have they think that, okay, because of us, maybe they think that they don't want to tell us the truth, the history. We diagnose COVID-19 mainly based on history. Clinically, we have category 1 to category 5. So based on the investigation, X-ray, but then we mostly rely on the history that the patient gave. Initially, when a patient comes to ED, okay, whether to send the patient to SARI or to send the patient to normal cubicle, we decide based on the history they give. So the history a patient give is very, very, very important. And now, after a year, we have hit a case of 9,000 plus cases in our country, which is the highest among all this time. So this is actually quite scary when we hear, and we are also scared that we might be infected or we might infect our loved ones. So what do? We isolate ourselves. We don't mix with our family members because we are scared that we will infect them. And there are many more things that's happening around actually in many hospitals. And nowadays what's happening is that our patients load are increasing day by day. Every day patients load are increasing. So for example, in my hospital, initially they had few wards for COVID positive patients, and now they are changing many normal wards to COVID wards. And they are lodging medical patients in other department wards as well, is because of we are not enough of COVID wards. And moreover, what happened in PIDS, we don't enough ICU as well, ICU beds as well. And what happened was recently, last week, pediatric ICU was changed to a general ICU. So it's to that level where COVID has actually spread. And I really don't understand what people are up to, whether they really do understand what are the complications that COVID could cause. And being as a house officer, my shift is actually, I have 3 shifts. So from 6 a.m. to 5 p.m., 6 a.m. to 9 p.m., and night shift is 8 p.m. to 9 a.m. But most of our medical officers are working 32 to 34 hours, 2 to 3 times in a week actually, which is quite tiring. And it's not easy to handle COVID-19 patients because we have to be in full PPE. Our medical officers have to be in full PPE. And when they are swabbing the patients, when they're taking bloods for the patient, when they're inserting CBD or whatever procedures that we are doing to the patient, we have to be in full PPE. And doing procedures in that PPE is not easy. It is difficult. Okay, and then moreover, what I wanted to share was after this outbreak, most of the medical officers, junior doctors especially, are relocated. So those who are in Sarawak, those who are in district hospitals, were put into a hospital where there's a lot of COVID outbreak. So they were relocated and they have to leave their families. They have to find for new accommodation, and a lot of things are happening. So we do take protective measures because we are afraid that we would be infected as well. And another thing that I wanted to tell was that I'm very impressive of the teamwork in all the hospitals in handling COVID-19 positive patients, starting from MAs, staff nurse, our medical officers, our superiors, everyone, because handling COVID patients is not an easy task actually. So I really hope that KKM would do something for junior doctors, especially because they are putting all their efforts. They really do sacrifice a lot because we are seeing what's happening in hospitals, so we know what's happening. We are seeing things. So I really do hope that KKM do something for them. And once all this COVID ends, I really hope that this would end one day. So when this ends, I hope that they do something for the junior doctors to become a permanent doctors. So I think that's all from my side.
All right. Thank you so much, Dr. Kana, for sharing your experience. It was really interesting, and we really understand the situation of frontliners, the junior doctors, as well as the situation and management of hospital during this pandemic. So on behalf of the community, we would like to thank all the frontliners. Yeah, thank you so much, Dr. Kana. And let's go to Q&A session. So there is a question related to AstraZeneca vaccine from Mohamad Helmi? That's an interesting question, but then we have a special speaker to talk about vaccination later on. So, Mohamad, so please stay with us till the end to get your answer. Yeah, thank you so much. And for you, Dr. Kana, I have
Yeah.
a question. So,
Okay.
as you're working in pediatric department, you are handling kids, babies,
Yes.
newborns, and so on. So, have you experienced any COVID positive cases with the kids?
Yes, we do. We even had a positive patient, like we are having outbreaks of positive patients in our pediatric wards recently, actually since last week. There was a patient, 6 months old, that he had underlying chronic lung disease. Because in pediatric department in our hospitals, what do we do is when our medical officer sees the patient in the emergency department, and
Yeah.
if they suspect that the patients are under SARI, meaning
Okay.
that patients who have symptoms like URTI, fever, so we
Uh-huh.
have a separate ward in our hospital. We call it SARI ward. So we will
Okay.
send the patients to that ward, and all the patients will be swabbed the next morning.
All right.
So when we swab few of the patients, so some of the patients turn out to be positive.
Okay.
So it is quite saddening because this COVID-19 is actually not targeting any age group. It's actually it is actually targeting all the age groups. Even we had
All right.
a history yesterday. There was a patient, 25 years old, in hospital. Where was the hospital? I think Hospital Labuan. There was a patient, 29 years old, passed away. So the cases that are actually increasing, and pediatric department patients are being positive as well,
All right.
regardless
Yeah.
of the age group.
So yeah, public are thinking that this virus is affecting only the elderly ones. So yep, to
It
avoid
do
this.
affect the elderly one,
Yeah.
those who have more comorbids, but it does affect the lesser age group as well.
All right. All right. So thank you so much, Dr. Kana, and let's
Welcome.
move on to the next speaker, Dr. Sivanantini Subramaniam, House Officer from HUKM as well. Welcome, Dr. Nandini.
Hi. Hi, everyone.
Hi. So how are you doing?
Uh, I'm just actually shocked from the news I just received because it's regarding COVID as well.
Okay.
I was placed at babies ICU. Okay, this ICU, they will place babies who are less than 30 days old, just born,
Alright.
newborn babies. So I was placed there, and today evening I was informed that the baby that I was taking care of turned out to be positive. Mother swab was negative.
Oh God.
Okay. So actually, when they do swabs at hospital, they divide swabs into PCR and also antigen. So to be safe, PCR is more sensitive compared to antigen. But we can't be running PCR for all patients, especially patients who are coming for delivery, because they might deliver anytime, and we cannot wait for PCR to come out, the result to come out, because PCR usually takes around 12 hours roughly there. When you take in the morning, the result will only be out in the evening. Sometimes in other hospitals, if you take today, the result will be out tomorrow. So what we practice is, if we think the history suggests of low risk patients, we usually proceed by doing antigen if there's no necessity to do PCR. So the mother she took antigen, and it was negative. So they proceeded like a normal labor, and the baby needed ICU care, so was admitted to ICU. And the baby, who is just, I think, around day 5 of life, is having COVID now. So as what Kana said just now, COVID doesn't know what is your age. It's not going to know you are a boy or you're a girl. COVID is COVID, and we can't see our enemy. So what I would say is, we should stay safe. And the most important part is, depending on what you have, like, let's say if if myself, I don't have any underlying medical illness, then the severity of disease might not even be there. I might be just asymptomatic, but I might be meeting someone who is severely ill, and I might just be passing the disease, and the manifestation of disease in that uncle or auntie will be more even severe. So
Yeah.
I think I'm going to focus on talking about changes of life
Right.
for the society and as well as frontliners.
All right.
As what? Yeah, sure.
So yeah, that's great. So please proceed with that. And I have one question for you. So how is your life before and after this COVID-19 pandemic? So you can also touch this point. So yeah,
Yeah.
so the room is yours now. So please feel free to share your experience.
Okay, when you asked me how was I, right? So I was just
Yeah.
overwhelmed with the news that I just received. So
Uh-huh.
yeah, so answering to your question, life has changed a lot compared to 2019 when I just joined as a house officer with a lot of dreams, trying to adapt with the house officer life, and suddenly, bang, COVID comes in my second posting. So as what Kana told, we were one of the few first housemen to work in the ward where they place COVID patients or COVID suspected patients. So it was a bit overwhelming for us, but I think now it has been a routine to actually take care of COVID patients. We know, I think initially we didn't know how the presentation would be like, and we were solely dependent on, we be dependent on the history of the patients. But nowadays we do have screening. Okay, in hospital wise, life has changed a lot because we go back in fear sometimes, you know, when you take care of patients with respiratory symptoms, that fear will be there. Oh my God, what's going to happen next? And if they decided to swab the patient, the whole night or the whole day, you'll be like, is it going to be positive or negative? Am I being quarantined or not? Okay, and those who are living with family members, they have a family to go back to. That is another issue that we have to see. Many of them, I've seen my MOs not going back to their small children at home because they're scared to go back. And they usually take rooms separately, live for days there without proper food after going back, after working long hours. So I think in that sense, the frontliners' life has changed in that way. Other thing is, usually once this norm of dining in has started after COVID, you know, after the case has settled down a bit, usually me and my friends, when we go for breakfast or something before COVID, we after night shift, we usually go with our scrubs and all. So even the normal usual shop that we go, they'll be like, hi, hello. They know us because the shop is just beside the hospital. So they know, hi, doctor, and everything. They'll just greet us and everything. But after COVID, even if you go to just buy a takeaway food, they'll be looking at us one kind, as though we are the virus carriers, you know, like we're wearing scrubs and all. Oh my God, they're scary, they're dirty, something like that. So in that sense, I think there is a little bit stigma for healthcare workers.
All right. So that's interesting. And there is a question for you. You mentioned just now the baby that you were taking care of yesterday was tested positive for COVID, but the mother of the baby is not positive. So the question from Arina is, how do you think the baby get COVID? If not from the mother.
It may be from the mother. It should be from the mother. First thing.
Okay.
Maybe the antigen was not sensitive enough to detect the COVID level. They have levels to say ratio to detect COVID-19 positive. When you send a swab to lab, they will see how high is the titer to decide you're positive or not. So maybe they should have gone for PCR for this mother. Maybe when we take PCR, this mother might be positive and she was in the normal ward for a whole while. And maybe there was symptomatic or asymptomatic healthcare worker who was taking care of this baby. Maybe this baby got it from a doctor, from a staff nurse, from a cleaner. You know, you will never know what's happening, right? Yeah. So because this baby was initially from a normal ward and had low glucose level and needed ICU attention. So it was changed from a normal ward to here. So different caretakers of this baby, so we will never know where this baby got the COVID from.
All right. So pertaining to this, there is another question from Famida.
Yeah.
Is it true that kids cannot spread the disease to others? And why do kids have very little symptoms? Yeah.
Mm, I would not say kids have little symptoms. Okay, first of
Uh-huh.
all, answering to your first question,
Yeah.
kids or anyone can spread this disease to anybody else. Okay, but
Okay.
the thing is, kids won't have much of a symptoms because most of them won't have any underlying disease. Most of the kids that you are seeing outside were healthily, I mean, before COVID, they'll be healthily playing around in the playgrounds and all. But there are ill patients that the society is not seeing. What are you seeing as a group of children is just tip of an iceberg. There are a lot of children who are bedridden, who have cancer, who are immunosuppressed. And these children, when someone asymptomatic just pass by and spend time without wearing mask for a few minutes, they might get it because they are immunosuppressed. So I won't say children won't get it or won't spread it. It can come to anyone. Anyone can spread it to anyone. So social distancing plays a lot of matter here, and wearing
Yes.
mask is very important. Yeah.
Exactly. For kids, especially, the parents need to follow the SOP and
Yeah.
take care of their kids really well. So, we heard recently that there is a new variant mutated for kids, for children. So,
Ah,
yep. So, all these things are, is crucial, and we really need to take care of ourselves and our loved ones. That's what
yeah.
we can do now.
Yeah.
Stay
I
home and,
just
yeah.
Yeah, I just want to add on a small tip of advice for
Yeah,
people who are watching this.
sure.
I would say that when you come to a healthcare place like hospital, clinic, or anything, nowadays they have screening outside to see whether you have any symptoms or do you
Mm-hmm.
have fever or not. Please be honest enough to answer that. If you have traveled,
Ah.
it's okay during PKP if you have traveled, because this is for your own health, for your own people, and people surrounding you who are going to take care of you as well. So please be honest in answering that. And yeah, and I've seen, newborn babies, they're carrying outside and going to supermarkets and all. I think
Uh-huh.
people need to realize the seriousness of this COVID situation now.
Yes.
Yeah.
Yeah, exactly. So that's a great piece of advice for everyone, those who are watching this and those who are going to watch this live video after it has been uploaded later after the forum. All right. So thank you so much, Dr. Nandini, for joining
Thank you.
us tonight.
Mm.
It's our pleasure to have you in our forum tonight. And
Thank you so much. Thank you.
yeah, and on behalf of the community, we would like to thank you for serving everyone. Yeah,
Thank you. Thank you,
thank
people.
you. All right. Okay, guys, so let's move on to the next speakers. So, as the third speaker, it's my pleasure to invite Dr. Sazali bin Basri from University Malaya Medical Center. Hi, doctor. So, yeah.
Hi, hello, hi. So, Assalamualaikum and very good evening. So, let me share my slide first.
Yeah, sure.
Okay, everyone can see my slide, yeah? So, when the organizer inviting me to give a talk, so they asked me to give a brief overview about COVID-19. So then I decided to talk about the COVID-19 and what happened to us or to me if we exposed the virus. So basically, COVID-19 or coronavirus disease 2019 is a virus or in illness primarily affecting the respiratory symptom. Is caused by SARS-CoV-2 virus. It was first reported in the end of 2019, December, from Wuhan, China. And at the end of February 2020, the first case reported in Malaysia. Subsequently, after a few weeks, it became global pandemics already. So I have been involved from the early pandemic in Malaysia. I was on call during the Chinese New Year, February 2020, and the first case referred to me is from Hubei district near to Wuhan. So then the story started in our hospital. How it's transmitted is mainly from by respiratory droplets with the R notes of 2 to 2.5. It means that one person usually can transmit to another 2 or 2.5 more people. So it can be transmitted directly or indirectly through contact and droplets transmission during coughing, during speaking, singing, that kind of stuff. So that's why by wearing a face mask properly, it able to reduce the transmission of the virus through respiratory droplets. Is not transmitted to airborne in the public or open space, but in some medical procedure, for example, when you're giving very high oxygen concentrations or nebulizer, it can be transmitted to such transmission, airborne procedures. So contaminated surface, or we call format transmission, is another transmissions of COVID-19, in which when the surface is contaminated by the virus, for example, our phones, then we're sharing the phones, and we then, after touching the phone, we're touching the our face, our nose, eyes, that kind of stuff. So the virus can enter our body through that. So it can lead to infection. Although there's reported case of such, the virus can be found in other body fluid, for example, urine, feces, breast milk, and other body fluids, but no such reported of COVID-19 being transmitted to other type of transmission. So from that, we need to avoid, we need to take care of ourselves to prevent the infections. So after being exposed to the virus, you may develop symptoms. So the incubation periods of COVID-19 is ranges from 2 days to 14 days. So that's why the quarantine period, if you are close contact of a person with confirmed COVID-19, sometimes is 10 to 14 days, because you may develop COVID-19 within the 2 weeks time, usually around 5 days. So you may develop symptoms, other common symptoms like other viral flu, such as cough, shortness of breath, fever, chill, muscle pain, body ache, vomiting, diarrhea. So it just, the symptom as similar as other viral infection, but I think the symptom of loss of taste or smell is something quite specific towards COVID-19, because it's also affecting our nerve system. So when you suspected you having COVID-19 because you've been exposed, you're having symptoms, you may want to proceed with tests, right? What test you want to test? So if you are sick now, there's 2 tests that you can be done. Either you do a PCR test, which is more sensitive and specific to detecting the virus, or you can do the RTK antigen. So both tests involving swab tests of your throats. The difference is the antigen test the result can be known faster compared to the PCR, but as Dr. Siva presented just now, is not that sensitive enough to detect COVID-19. So some antigen, although the RTK is negative, but the person may have COVID-19 if you're doing PCR test. That is what usually we do. We can do blood tests, but the blood test is to detect the antibody, but it doesn't tell you either you are sick now or infected with COVID-19 and able to transmit the virus to others. Antibody tests just inform us that you have COVID-19 before or you being vaccinated before. So it doesn't help much in terms of diagnosing COVID-19 when you are sick. So the other things that you must remember, if you are tested negative for COVID-19, it doesn't mean that you are negative, because, for example, if you are exposed with person with COVID-19 today, and you swab immediately after you exposed to it, you may test it negative, because as I said earlier, or I presented earlier, the incubation period of COVID-19 is 2 to 14 days. So you tested negative after immediately exposed to the person, but that's why we advise, if you have symptom, you can do the test immediately, because it's likely you will, you will likely get positive result. But if you don't have symptom, you just have a close contact to person with COVID-19, you need to wait for few days before you do the test, because if it's test negative, it doesn't mean that you are truly negative. The other thing, if you tested negative, maybe the quality of swab taken is not that good. Maybe just take your saliva and not good enough, not deep enough to detect the virus. So if you are tested negative at day one, it doesn't mean that you won't get sick. You can still get sick. You can still sick after that. That's why if you are exposed to person with COVID-19, although your first swab is negative, you still need to continue your home quarantine according what's the home surveillance order being given to you. Yes. So not when we're exposed to COVID-19, not everyone will get infected. As I said just now, the R0 is around 2 to 2.5. If you're unfortunate and exposed to COVID-19 and you got COVID-19, you may develop asymptomatic, in which you don't have symptoms. You are well like other persons, but you have the virus and you can transmit the virus. It's around 20% of people have asymptomatic carrier of COVID-19. About 80% may have symptoms. If they have symptoms, they may just have mild to moderate disease, about 80%, and the 20% of them may have severe disease in which requiring ICU admission and even death. So when you have severe disease, it's not only affecting your lungs, it also affecting your heart become weak, your lungs become stiff and scarred. It affecting the kidney. Some person require dialysis because of the infection of COVID-19 and the complication of the COVID-19 is affecting the brains. We know COVID-19 people with COVID-19 at risk of getting stroke. It affecting the nerve. That's why you having this altered sense taste and also reduced smell. People may have cognitive impairment and memory impairment because of COVID-19. And we saw a lot of people being depressed after diagnosed with COVID-19 because a lot of uncertainty, worried about being affected with the virus, worried about what people will think about that, worried about are they transmitting the virus to people surrounding them, to their family, to their beloved one. So this is, we saw a lot of people with psychological distress after being diagnosed with COVID-19. As I said earlier, COVID-19 is not just another flu. Although you may have mild to moderate disease in which you just have cough, fever, but you don't require ICU admissions or you even don't require hospitalization, but you may develop long COVID syndromes. 30% of people with mild to moderate disease may develop long COVID syndrome. Common symptom that they presented to us after being followed up in our clinics, they have persistent extreme fatigue, persistent symptom of headache, sometimes difficulty in breathing, especially for Muslim when they are praying, when they are rukuk, and also when they are sujud, they have this chest discomfort. They have mild fever and they're a bit blur compared as their usual. It's lasted up to 3 months. That we call this as a brain fog. As I said, COVID-19 is not just another, it's just another flu. It's do affecting people not only physically, but also psychologically, and the socio-economic effect of this COVID-19 being stigmatized by other people surrounding it, losing jobs and others. So we saw a lot in our clinic, people crying in front of me because being terminated from their works, because being accused transmitting the virus to their colleagues and their workplace, being halal from their neighborhood to the flat because people need to be quarantined, they're losing your job and others. Yes, when we need also think about their family, when people get infected, family members unable to visit the patient. I still remember about my first case, COVID death in my hospital, very elderly lady who are sick alone in the rooms and unable to be visited by family. We do video calls daily with the family, updating the family. But as you know, when our beloved parents are sick, of course, we want to get together, but it cannot be done because of this COVID-19. So COVID-19 is not just another flu. It's only not affecting our health physically, but mentally and also socio-economic effect, and also people surrounding us also affected with COVID-19. So when we talk about COVID-19, we know about 80% have mild disease, but certain population may develop severe COVID-19 in which they require hospitalization, ICU admission, and respiratory support, and even death. For especially when they are elderly, age more than 60, they have cancer, kidney problems, lungs problem, smoking, or diabetes, obesity, and other other medical problems as listed here. Pregnancy also associated with severe COVID-19. So this is a pictograph from our Ministry of Health about our quarantine times. So a lot of people doesn't understand about this. So because when they are close contact, they swab, then without waiting for the swab result, they walking around and transmitting the virus, that kind of stuff. So even if the swab negative, as I said, it doesn't mean they are truly negative. So they need to wait until the quarantine times been finished. So usually if people have symptom, the day one of illness is from the day of the symptom develop, and they need to continue to be quarantined up to 10 days from the onset of the illness. And they must recover from the symptom, from the COVID-19, in which they don't have fever for at least 1 day and the improving of the symptom. Then after 10 days, doesn't require to repeat swab, and they are non-infectious already. So if you are under home surveillance order, you need to be you need to really practicing self-quarantine. So COVID-19 in Malaysia is very bad now. So today we reported more than 9 cases daily. So we can see before we had win the battle, but somehow we call it pandemic fatigue. We start to reduce our safeguard to protect ourselves and our people surrounding us. So that's why the case is increasing. Even recently, CDC had said that Malaysia is a red country with a very high COVID-19 cases. So to prevent COVID-19, we must practice vigilant practicing 3W, wash your hand hygiene practice, wear face mask properly, and practicing other SOP, for example, social distancing, avoid gathering, cough, and also ethics and others. And nowadays we have vaccine. I believe Dr. Helmi will talk about vaccine more after this. And yeah, we had win the battle before, Malaysia being recognized as one of the country that successfully handling COVID-19. But because of pandemic fatigue, we lost the battle, but don't forget, we must win. Kita pasti menang, and we must win the battles. And we need cooperation from everyone to win the battle. I think with that, that's my talk today, and open for Q&A.
All right. Thank you so much, Dr. Sazali, for the enlightening talk. And I believe that you have shared your knowledge to the best of your ability to the public. Yeah, that was really interesting. And we have few questions in the chat box. Let me have a look at the questions. Okay. Yep, the question is from Ahmad Zul Helmi. Am I at risk for COVID-19 from mail packages or products? Yeah.
Sorry, what's products?
Mail packages or products. I think he is considering on the delivery. Yeah, delivery of products and all those stuff. Yeah.
I mean, contaminated surface can transmit the virus, but the virus cannot stay in our hot climate for so long. So yes, theoretically, it can last in surface for a few hours, that kind of stuff, but it's less likely. The transmission more toward direct through respiratory droplets and others. But yes, if the person who deliver the product have COVID-19 cough, then you touch the things. If you're not practicing hand hygiene, then you get infected. But if the package is contaminated, but you after touching it, you're practicing hand hygiene without touching your face. So
yeah. Yes, of course, during this pandemic, so we are not going out for purchase, and we prefer more on online delivery and online shopping. So in this case, we need to have a direct contact with the person who delivers the product. So we really need to take care of the SOPs when we receive a specific product from the delivery man or girl. Yeah, all right. So
That's why
yep.
hand hygiene is important.
Yeah. All right. So thank you so much, Dr. Sazali. So please stay in the Zoom. So we will have a group discussion later after Dr. Helmi's presentation. Thank you. Thank you so much. All right. So next, let's welcome Dr. Mohamad Helmi bin Mohamad Yasim, Medical Officer from the Research Development and Innovation Department as well from University of Malaya Medical Center. Thanks for joining us, Dr. Helmi.
Welcome. Thank you for inviting me.
All right, so it's our pleasure. So Famida will help us to share the slides of Dr. Helmi. Yep. Okay, so you may start, Doctor.
Assalamualaikum and good evening, everyone. I'm Helmi from University of Malaya Medical Center. Thank you, first of all, to the organizer for inviting me to give my opinion and a bit of talk regarding COVID-19, specifically on the COVID-19 vaccination in Malaysia. So first of all, vaccines. What is vaccines? What do you know about vaccines? Vaccine is actually just a simple, safe and effective ways of protecting people against harmful disease. In this case, it's COVID-19. There are about 19 type of vaccines available in the world to protect against a lot of disease, but the latest vaccine that's available is the COVID-19 vaccines. Vaccines actually trains your immune system to create antibodies, hence to protect yourself from COVID-19. It contains a lot of, mainly basic kill germs or bacteria, are also modified viruses that will be injected to the body. Hence, it will create antibodies to protect you from getting the disease itself. Into December 2020, our Prime Minister Tan Sri Yasim has announced that Malaysian managed to get about 82.8 million of, managed to get about 26.5 million vaccines, which we target to give vaccine to about 80% of the Malaysian populations. So these vaccines are going to be given to three main groups, which are the frontliners, the elderly or the high-risk group, and also the 18 years old and above individuals. There are 5 types of vaccines that are available in the world, but in Malaysia currently we are using just 3 types. We are using the Pfizer vaccines, which are made from USA, AstraZeneca from England, and also Sinovac from China. These 3 vaccines has different efficacy, but the goal is the same, which is to reduce the mortality and the admission rate for people who get infected with COVID. The vaccine policy currently is available to all Malaysians. We open the slot to everyone. It's voluntary. Everyone can admit. They can apply to get the vaccines. They must be above 89 years old. We aiming to vaccinate the 80% of the population in Malaysia by February 2022. There are 3 strategies for vaccine program in Malaysia. Currently, we are in the 2nd stage. The 1st stage we already completed in April. The 1st stage was to vaccine all the frontliners, the doctors, nurses, policemen, army, and everyone who are involved in the front line. These vaccines, we targeted to vaccinate about 500,000 of frontliners. In PPUM as well, we vaccinated about almost 9,000 to 10,000 of frontliners. They all received the Pfizer vaccine and they have completed 2 doses of Pfizer's vaccines since last April. Currently, I'm handling me and my team with Prof. Sazali. We are doing the phase 2 project for the vaccines. We are vaccinating all the elderly people who are above 65 years old. However, due to the large populations of Malaysian citizens, there are about 9.4 millions of senior citizens. Hence, we have to choose who we have to vaccinate first in our center. UMC is a privilege because it has been chosen as SPPV, which is a Pusat Pemberian Vaccine Special. So it means that our vaccines are given to patients who fall into 3 categories, which mainly the immunocompromised patient, bleeding disorder, and also severe allergies. Those who those are not in the categories will be vaccinated in the PPV community, which are mainly in the clinic kesihatan or even in the district hospital or in private clinic. So there's a special form that you have to fill in if you fall into this category, the immunosuppressed, severe allergies, and also bleeding disorder. For you to be able to get a PVA form or pre-vaccination assessment, you have to go to the clinics, and then when you are in the risk of you fall in the 3 categories, you'll be consulted by the doctors or the specialists, and you'll be assigned to be vaccinated in SPPV, which in PPUM. So for those who does not fall into category 2, phase 2, you will get your vaccine in the phase 3, which are in May 2021 until February 2022. So this mainly will target all adults population who are above 18 years old, and also who are in the most likely in the red zone or yellow zones. This actually to provide the herd immunity to the community by pandemic control measures. So if you guys hasn't apply for vaccines, you can apply to register your vaccination by using My Sejahtera. So there are few things that you have to fill in, which are your name, IC, and place of vaccination. This is important because we want to allocate the amount of vaccine that will be supplied to some center. If the center has high population and dense population, we will give more doses to that center so that more vaccines can be reached to all populations. However, in March recently, the registration for COVID-19 vaccination is still low, about 6%. This is sending because vaccination is important to give herd immunity for the community. Last week, the AstraZeneca vaccination has been open, and there's about millions of doses that are able to register. And hopefully you guys that does not get any slot for the vaccine that time will get a slot by checking your My Sejahtera. This is vaccination. Our aim is just to get the herd immunity for everyone. We want to fight COVID. We want to reduce the COVID pandemic in our country by giving herd immunity to everyone in the country. Hence, by giving them herd immunity, everyone that will get infected will reduce the rate of infectivity to other person. Hence, this will slow down the COVID pandemic in this country. With that, I'm open to any questions. And for the time being, kita jaga kita, stay safe, everyone. Thank you.
All right. Thank you so much, Dr. Helmi. It was an interesting knowledge sharing session. Thank you so much again. And we have few questions for you regarding the vaccination program. Yeah, first of all, we go back to the earlier question asked by Ahmad Zul Helmi as well. So, can I know details about AstraZeneca vaccine? So he wants to know more information on the AstraZeneca compared to the other types of vaccine.
Okay, this is interesting because AstraZeneca is kind of open to publics and also everyone. AstraZeneca is a vaccine that is made from Oxford in England. Okay. All right, so it's a viral vector vaccine, which is a modified version of the virus, and is injected to the body intramuscularly. So it became a big topic because of the side effect that has been published around the world. However, the side effects of the vaccine is very low. The most side effect that is everyone is scared of is actually the blood clots. Due to AstraZeneca vaccine, the risk of getting blood clot is actually just 1/100,000. Okay, compared to you when getting COVID. If you get a COVID without any vaccination, you have higher risk of getting blood clots. Okay, so by getting a vaccination, it's not a big risk for you to get the blood clots. Even if you're smoking or you're taking any inhalation methods of smoking or vaping, it actually has higher risk of getting blood clots compared to getting vaccine. So vaccine is safe for everyone.
All right, that's great. So the risks is different, yeah. So those who have got vaccinated compared to those who have not, the risk of getting the blood clots and then the side effects of this COVID-19 are different. So that's why the government is advising people to get their vaccines. Yeah. All right. So another question related to AstraZeneca as well. Okay, so this question is from Prashant. So AstraZeneca vaccine, is it safe for those who plan to get pregnant?
Okay, for AstraZeneca, we advise people who want to get pregnant or breastfeeding to just wait first, because there's no proven scientific data. It's more advisable for them to take Pfizer vaccines because it has more literate views, and it's safe for those who want to breastfeed. For AstraZeneca and Sinovac, there's a bit of, we still are in the research program, and we are advising them to withhold first the AstraZeneca time.
All right.
Can I add something?
Yeah, sure, Dr. Sazali. Yeah.
Okay. Basically, if you're planning to get pregnant, please get vaccinated before you're pregnant. Because pregnancy itself has higher risk of getting severe COVID. So vaccinated first, then only can get pregnant.
Yeah, that's a great piece of advice. All right, I hope the answer was clear for this. And then, another question from Arina. Dad has stroke for the past few years, so is it okay for him to get the AstraZeneca?
For AstraZeneca, we can take still can take the vaccines, but we just need to monitor more. And the vaccine should be given in a special area like SPPV. Yeah.
All right. So there are special requirements for those who have other illness, comorbidities, if they wish to take this AstraZeneca. So I think they need to consult the doctors first. So what do you say, Dr. Sazali?
Okay, for AstraZeneca, basically deals with people with medical problems, including heart attack or history of stroke or any other medical problem at risk of getting severe COVID. So the aim of vaccination is to prevent them from getting severe COVID, admitted to ICU and death. So that the aim of the vaccination. So they are eligible to be vaccinated. So go ahead with the vaccine. That the risk of them getting clot, the risk of getting clot is higher among young females rather than elderly with history of stroke or heart problems. So they just can go ahead with vaccination, no issues. The only precautions of for AstraZeneca, for any vaccine, if you have history of severe allergic, if you are on blood thinning medication, if people on stroke on aspirin can go ahead with vaccination at any place, no problem. But if they're on special medication, for example, warfarin or anticoagulants such as dapixaban, dabigatran, or special medication, they should be vaccinated in special pusat pemberian vaccine such as hospital setting, or if they are immunocompromised. So otherwise, regardless whatever illness they has, they can be vaccinated at any places. And once the vaccine available to you, just get vaccinated. Don't wait for get at special place or anything.
Yeah, that's great. So, in line with this, there is another question from me. So, can you please advise on what are the ways people can seek to check whether they are eligible to get vaccinated or not, especially for those who have other medical problems? Yeah, any one of you? Feel free to answer. Yeah, what are the ways? How can they check whether they are eligible or not? Maybe Dr. Nantini, can you explain like how can they consult their doctors on their medical problems, whether they are eligible to get the vaccines or not?
Okay. As far as I know, from the settings that we received vaccine previously, there will be a questionnaire that you have to fill up yourself, whether you have any underlying medical illness or not. For me, when you already get a slot, if you're already registered, if you still have the doubts, you can clarify there because there will be medical officers there for you to, when you sign your consent, they will be there with you to see if you have any underlying. They did stop because when we received the Pfizer vaccine, one of the earlier days in March, they did stop some pregnant people to come in, and then they said, no, wait for some time. And then later on, they open a batch for those people. So other than that, if you're not registered yet, I think there are a lot of online sources which are trustable ones, the medical related, or you can just approach any healthcare workers. From what I know, I don't think so there's other way to know the criteria for you to know whether you're eligible for COVID vaccine.
All right. Okay. Thank you, Dr. Nantini.
Can I
And
add?
yeah.
So basically,
Yeah.
any medical problems, you are eligible for the vaccines, no issues. If you're not sure, just ask your primary doctors about it. And most of the times, we will fill up the form of pemberian vaksin, pre-vaccination assessment. Yes, pre-vaccination assessment. So then we know lah. So even in My Sejahtera also, when you register for vaccination, they will ask you, do you have any this medical problem, allergic, that kind of stuff. So which is you just need to fill up the My Sejahtera. So no issues. Even during the vaccination, you'll be screened again and be consulted by the doctors there. So there's a lot of what we call safeguardings to make sure you are truly safe for the vaccines. But there's no illness that contraindicating you from getting vaccine unless you have allergic to the compound in the vaccine or age below 18 in Malaysia.
All right. Okay. So those who are watching, so if you had a so unless for the allergic, so if you have any allergic for the vaccines, so you can consult the doctor for more information. All right, so another question regarding this AstraZeneca as well, it's interesting. Okay, so it's about the effectiveness of this AstraZeneca vaccine towards the variant. So this question is from Jayanti. Is current vaccines effective against new mutated Indian variants?
So I would like to give some input on this. All vaccinations actually will reduce the infective. It will not be. It will reduce you getting the COVID, but the main goal is actually to reduce the mortality and admission rate to the hospital. So if you are not vaccinated, you might get a severe COVID category 4 to 5, which we want to reduce that. So by getting vaccines, we actually does not prevent COVID-0, but we prevent the COVID from getting worse in your body. So you might, if you get a vaccine and you get infected, you might just get category 1, category 2. The data has shown that only 0.001% of patients who has been vaccinated and get COVID they only develop very mild symptoms or even no symptoms, or they have very low infective rate to other people. So that is good because we want to help ourselves and the community from us getting spreading the disease to other people. So by getting vaccine, it's not preventing COVID-0, but it's actually to reduce the severity of you if you are infected with COVID-19.
All right.
Uh, Yes, about the variants, basically, there's few circulating variants in the world. So there's original Wuhan variants, there's UK variants, Brazilian, South African, and also Indian variants, right? So although the data is still limited, but a lot of evidence now prove that AstraZeneca and Pfizer are as effective against these variants. Although it's effective to prevent the severe COVID, although it's slightly the effectiveness, for example, if the original Wuhan's variant is about 95% for Pfizer, but maybe it's around 85% to prevent symptomatic COVID-19, but it's still effective, and it able to prevent severe COVID-19. So AstraZeneca and also Pfizer as effective in preventing UK, South Africa, and also Indian variants. There's limited evidence about Brazilian variants, but it's effective. We don't have much data on Sinovac, so that's why Sinovac's requirements a bit strict compared to other vaccine.
All right. Okay, thank you, Dr. Sazali and Dr. Helmi. All right, so with this, I think we have few more questions. So yeah, we can go for it. Before that, we had a question on what are the benefits of this vaccine. So I believe that that question has been answered from the previous discussion. Yeah, so the aim and the objective of this vaccination program is not for COVID-0. So as mentioned by Dr. Helmi, it's just to minimize the mortality rate and also the admission to the hospital and the risk of the COVID-19 patients after getting vaccinated. Yeah. All right. So moving on to the next question from Hayati. I have MDD and still taking medicine. Am I at risk? This is the question.
Yeah, you are still at risk and you need to get vaccinated. Yeah, according to the criteria in the PVA form, those who have underlying psychological psychiatrist appointment will be vaccinated earlier compared to others. So you need to be vaccinated.
All right, thank you. So there is another interesting question from Danusha. So there are two friends who were close to each other, sharing food and drinks, and they were involved in activities together. So one was tested positive, but the other one was negative, the close contact with the positive. So she's asking, so how is it possible? So why he was tested negative, even though he was closely involved with the activities with the person?
I think, as mentioned by other speakers just now, if you are positive in the first day, you might be having symptoms and be positive for 8 days to 14 days, but your friends, when she or he just got infected, he might be negative for the first few days. So the infectivity rate is different for everyone. So you might be day 1 of COVID and she or he might be just day zero. So it is not different. It's different timing for everyone. So as mentioned by the speakers just now, the baby is tested positive and the mother is negative. But we doesn't know that if the mother is actually positive, but due to the strains has been low infective rate, so it produces a result of negative. So still need to do social distancing and follow the SOP.
The other thing depends, although you are in the same place, either you practicing SOP or not.
Yeah.
2 person in same place, but one is wearing mask and the other one is not wearing mask. Of course, the one who's not wearing mask is the risk of getting COVID is higher. If the one is always practicing hand hygiene, the risk of her getting COVID-19 is also lower. And also where's the place is, if the person is nearer to the persons who are infected, of course, the ones who are nearer to the person who has the COVID-19 is the chance of getting COVID-19 is higher. And also depending on the ventilation of the place also. So a lot of factors involved in this transmission. Is not only simply but it depends on our immunity, are we practicing the SOPs, and yes, and also our immune system.
All right. Okay, thank you. So let's go for the last question for today's forum. Okay, so this question is from Eugene. His auntie just got discharged from hospital after tested positive, and then she has been having lung problems. Since she's out of the hospital, so he's asking, is it safe for his auntie to take vaccine at the moment?
Yeah.
Yeah.
Okay. So basically, if someone who just tested positive for COVID-19, we usually wait for 2 to 3 weeks to get the vaccines. So if you got the appointment within the 1 to 2 weeks, we usually defer the appointment about 2 to 3 weeks after that, so that the immune system can actually develop first before we boost vaccine, which is the weakened version of the COVID-19. So we usually wait for 2 to 3 weeks first.
KKM says 3 months after the first infection. So you need to wait for 3 months, but theoretically there's no issues. You get vaccinated as long you are ready for it, as long not during your quarantine period. Is so that you go to the vaccine center but you transmitting the virus. So you shouldn't get vaccination during your quarantine period, but as long you recovered from the virus, is your infection, if you're ready, you can get vaccinated, no issues. But KKM say wait for 3 months.
All right. So it seems like people are interested to know more about this vaccine program. So can we go for one more last question? So yeah. Okay. So it's from Darshini. So she's asking, someone who is asymptomatic got the first dose on 21st of May. Okay. First dose on 21st of May, tested negative for RTK, but then positive for PCR on 28th of May. So she's asking, is this because of the antibodies are not developed yet? So yeah, how about this? Maybe Dr. Kana, can you try to answer this question? So the first dose on 21st and the second 28th. So they got tested positive in between the period of the,
Okay, I think first of all, that everyone should know or understand that getting vaccination is actually it's not that okay, no, I'm not getting COVID anymore. No, that statement is wrong. No, getting vaccine is just to reduce the risk of getting COVID and also to reduce the complications that we are getting from the COVID-19. So, and the according to your statement that the person got her vaccination on the 21st, and then tested negative for RTK, but then positive PCR on the 28th. So it is just few days in between, and she haven't completed her vaccination as well. So I don't agree with the statement that she didn't antibodies are not developed. So vaccination, we are getting vaccination is actually just to prevent the complications from the COVID-19.
Sorry, is it vaccination or infection? Because it's a bit weird. Because the first test is 21st, right? And the second is 28th. It's the test, not the vaccine, right? So as I said, the incubation period ranges from 2 to 14 days.
14 days.
So maybe the first is not, he doesn't develop the things yet. So only on the 28th, she developed the symptoms and got tested. And the other thing is, if the vaccination is only effective the 95% effectiveness of Pfizer is 2 weeks after your second dose, not immediately after your first dose. So people still can get COVID after their first dose. Even after they completed second dose, they also can get COVID. But we know if they got COVID post-vaccination, they tend to get milder symptoms, non-severe COVID-19 compared to those who not vaccinated.
All
So,
right.
and the other thing is, if you are within, if you're swab, you need to, it means that you need to be quarantined. So don't
Yeah.
go to get your vaccine. You need to wait your quarantine period finish, only you go to the vaccine center, because we don't want you to transmitting the virus to others. Please
Yeah.
inform the pusat pemberian vaksin so that they can reschedule your appointment. So don't worry if you didn't turn up because of need to be quarantined, just inform them, they will reschedule your appointment.
Yeah, exactly. Related to this, there's another question from Sheila. So, how long will it take to build immunity after getting the COVID-19 vaccine? So, maybe after completing the second dose.
2 weeks, 14 days.
2 weeks. 5.
Okay, 2 weeks. All right. Okay, so I believe that it was a fruitful discussion together with all these special speakers that we invited for this forum on COVID-19 awareness. Thanks to all the audience who are watching this forum online on YouTube Live as well. Okay, now I think we can end our session today. Before that, I would like to invite all the organizing committee of this COVID-19 forum to join us as well for the closing session.